Okay, hi everybody. Thank you for joining us for this business update and welcome. My name is Sean Collier. I'll just run you through the agenda for now. I'm the Business Enterprise Manager for North Tyneside Council. So I'll spend about 10-15 minutes going through the business grants and the general business support available. Then pass over to my colleague, Wendy Burke, our Director of Public Health, who will take you through some of the public health issues. And then we'll take some questions. I'll take some business support questions and run into the public health ones, obviously, as well. If you could just input those questions via YouTube live chat, and we'll pick them up later on. The plan is that we'll have some frequently asked questions after this at the end, which we'll put on the council's website. So if we don't get the chance to cover every question today, we'll pick it up later on, and for people who couldn't make the session as well, who can join us later. First of all, look at the grant schemes. There's 3 grant schemes here. The local restrictions grant support grant is the one I'll concentrate the most on. That's the most complicated area and the main funding area we've got. Touch on the Christmas support payment, which is the £1,000 to pubs, and the additional restrictions grant, which is a fund for the local authorities to deliver. The local restrictions support grant, it is complicated. Apologies for that. We're delivering the government scheme, but we're trying to keep it as simple as we possibly can. There's 3 main periods that I'll split it into today. So there's the 18th of September to the 5th of November, which is classed as the open period, which is a period prior to the national lockdown where local restrictions were in place. The funding for the grant for this area is available to hospitality, accommodation and leisure businesses and their direct suppliers which are occupying commercial premises. So any businesses in that kind of sector can apply for that grant. Under the national lockdown period, 5th of November to the 2nd of December, we're looking at any businesses who were required to close. So that's not businesses who've closed because they're unable to make a profit. It's only those that have been required to close by the restrictions. So that's the closed period, 5th of November to 2nd of December. And then there's a period we're in now, which is after that lockdown period, the Tier 3 period, where we're just aligning the grant schemes that we've got now. The government guidance on this was only issued last night, so that grant will be available in the next week or 2. It is complicated a bit further by it's not being a one-off payment, that it's a monthly allocation for those grants, and it does depend on which scheme you're in and also which rateable value, the rateable value for your commercial property. So, for example, if your rateable value is less than £15,000, then the payment in the open scheme per month is £934, and in the closed scheme is £1,334. Same way if the RV is 15,000 to 51,000, it's 1,400 in the open, 2,000 in the closed, or above 51,000, 2,100 payment per month, or 3,000 in the closed scheme. So it is complicated, apologies for that, but I'll just cover some of the key criteria as well for the scheme. The full criteria is available on the council's website, but one of the eligibility criteria is around trading prior to restrictions. So your business must have been trading directly before the local restrictions came in or the national restrictions happened. Their business must be able to demonstrate that they've been severely impacted by those restrictions as well, and also must qualify for state aid. We do have to ask about state aid, but it's a bit of a difficult thing to do, and it's not that relevant for businesses. Most SMEs it's not an issue for. The only time it will be an issue really is if your business is more than €200,000 worth of public support in the last 3 years. So for larger businesses it might be an issue. So for example, if it's a Greggs and they've got multiple stores, then they're going to hit this issue. But the vast majority of business is not going to be a problem. With regards to the evidence that we request for the application process, the grants are aimed at business rates payers. So we would ask for your business rates account number. Where you're occupying commercial premises but you don't have a rates number, we would ask for a lease and a bank statement as well, to provide as evidence. Government do ask us for a unique identifier as well for each business. Where you're a limited company, that's quite straightforward. We can ask for your company registration. If not, it needs to be your NI number, tax reference or VAT reference, something that's unique to your business or you. We also need to ask you the value of business support over the last 3 years. That's for the state aid issue I mentioned earlier on, just to check you're not over the €200,000. So for example, if you'd had a £10,000 grant across the summer, we'll ask you to record that on the form. And finally, as I mentioned, just the full criteria for the scheme is available on the website. And an online application form as well. I'll show you where that is in a second. We are putting together a video which shows you how to go through the application form as well, which will be up on the website from next week. Just very briefly on the council's website, this is the council's homepage, obviously northtyneside.gov.uk, and going on that scheme, there's a couple of places you can access the criteria in the application form. If you see the black box in the middle of the screen there around coronavirus and COVID-19, if you click on that, there'll then be a list of different categories there, and one of them will be local restriction support grant. Alternatively, you can click on business on that section, which takes you to this page, and on the middle section here under business support, again, that will take you to more information. This is the page it goes to. You see the second one down there under contents is local restriction support grant. It also mentions business recovery programme, which I'll also cover briefly today, and North Tyneside Business Forum, any other support as well. Briefly touch on the Christmas support payment. That's the grant the government's announced for wet-led pubs. So the definition is just emerging on that, and they did issue guidance yesterday on this, and it's emerging that it's a pub where less than 50% of the income comes via food. It is a £1,000 one-off grant. Government advised that an application is required. We hoped it wasn't required for this scheme and we'd be able to just issue it because we know who the pubs are now. But they've asked us to submit an application for it, which again will be on the council website in the next few weeks. We haven't had a funding allocation yet from government, and there is a second lot of guidance to come through as well. So we're just waiting for that and we'll come forward with it. You may have heard about additional restrictions grant as well, which is something else that another source of funding that the council have received. It's not available for businesses to access at the moment, but it's a fund that the council have been given to cover other grant schemes, to cover any discretionary support through the local restrictions support grant, covering general business support programmes, and to fund any future lockdowns. This is a different scheme to the others because it's not a set grant scheme, and it's also over a much wider period. So this fund goes until March 2022, so it's about 15 months or so period that we've got to cover, and as it mentions there, we'll cover any future lockdowns. If we go back into lockdown period in the spring or in February, March time, then it needs to cover that period as well. Government said very clearly this won't be topped up, so it does need to last, and we've approached this on a regional basis, which I'll mention in a second. But what we've used it for so far is to provide a discretionary scheme for the local restriction support grant. So, for example, the supply chain companies of the hospitality, accommodation and leisure businesses can be supported, and those without who are in commercial accommodation but don't have a business rate scheme. So that's what the fund's been used for so far. Mentioned we've got a regional approach, so all of the schemes that I mentioned so far are aligned with our 7 local authorities across the region. We've stuck to the core government criteria and agree the standard grant payments. There is some small flexibility around that, which we're trying to keep to a minimum, so it's a consistent scheme, but that's the situation. So, for example, in Northumberland, there's a lot of accommodation businesses. There is hundreds of them which don't get funded, so that use their flexible funding towards those, which is less of an issue for ourselves. And I'll touch briefly on business recovery. So it's another fund we have to support businesses. It's not a grant scheme as such, but it's hands-on support. It's not funded from the government part, it's funded from the North Tyne Combined Authority, but it's fully funded specialist consultancy. So, for example, if you want to develop an e-commerce website, an online booking system, some social media support, look at innovation, so you want to develop a new service or a new product, improve your sales and marketing, or diversify your business, we can bring in an expert consultant to help you do that, and it wouldn't cost you anything. That's fully funded. So we've had over 100 people come through that support already so far, and you access it via the council website, as I touched upon earlier on. A little later on, we've got some questions, but in relation to this, you'll have seen already on the live chat, and I know some people have made questions already, so please put them in there. I mentioned at the start, we'll try and pick up all the questions, those we can and can't answer through FAQs, so people who are not on the scheme can get access to this as well. If you have any specific questions you want to ask, which might be just only relevant to your business, and want some clarification, then please email us at business@northtyneside.gov.uk. There's the council website there, northtyneside.gov.uk, and also the North Tyneside Business Forum website. In relation to the Business Forum website, I would recommend anybody joins the business forum if they haven't already. Where there is any new business support programs, we put those out through the business forum scheme as well. So we will email anybody that's registered when there's a new scheme. So it's really useful. They do loads of events throughout the year under normal circumstances and just provide that support from other businesses to help you keep going. That's the end of my part. I'll just give you a second or two to note down any of those numbers if you hadn't already. And I'll cover questions in a moment after I've passed over to Wendy. So I'm going to pass it to Wendy now. She's going to give you a presentation on the public health aspects and then come back with questions at that stage.
Good evening, everybody. Okay. So I'm going to provide a bit of a public health update for you, and we're going to start by just having a think about the impact of COVID-19 across the borough of North Tyneside. And I think it's fair to say that the impact has been felt by every aspect of society. And we know that it's going to take some considerable time to recover from. There is no doubt that the impact of the virus is well beyond just the direct effect of it on people's health and well-being. We know that socially and economically the impacts have been far-reaching. And some of the figures there that are on the slide just kind of give an indication of some of the impact that we felt locally. So just thinking about universal credit claimants, they've gone up from 11,000 in March to 18,800 in September. Similarly, those people searching for work is up by 3,200 people. Obviously, town centre vacancies are a concern to us, and the fact that there's just not the job vacancies that are around, and new business startups have decreased by 23% in the period of the pandemic. So the reach of the pandemic is wide-ranging, it's fair to say. What I'm going to do now is just take you through some of the public health data, and then we'll focus on some important public health elements specifically for business. So this first slide just gives you a bit of an idea of the epidemic curve for North Tyneside throughout the period of the pandemic. What it shows is that the second wave that we've experienced in late October and November, we're starting to come out of. The infection rate is going down. It has gone down fairly rapidly. I think it's hard to say at the moment whether or not we've actually felt any impact yet from the easing of the 4-week restrictions on the 2nd of December. So I think the next few days, it'll be interesting to see if the rate of decline slows. I assume that it will. But certainly the 7-day infection rate sitting at 119.3 for 7 days per 100,000 population. That means we've seen 248 cases in the last 7 days. In terms of the infection rate by age group, again, it's a declining picture right across the age range, with the lowest rate being in the 0 to 14 age group and the highest rate being in the 15 to 35, but very closely followed by both the over 65 age group and the 50 to 64. And of course, the older age group is the age group that particularly worries us as directors of public health, because we know the impact of COVID increases with age. In terms of the testing data, we continue to test a huge number of people right across the borough. So we're testing in the last 7 days 5,374 people. As I say, 248 people tested positive in the last 7 days, with a positivity rate of 4.61%. The positivity rate has been as high as 15% at the height of the second wave, so that has come down significantly and tells us there is less circulating disease in the population, which is good news. This is the data that we've accumulated since the beginning of the pandemic, looking at the total number of positive cases by ward right across the borough. And I think you can see at a glance that it shows it's a fairly unequal picture, with far fewer cases and lower rates right across the coastal strip, and much greater rates and cases in Collingwood, Churton, Riverside, Howden wards, which is no surprise to us, because of course we know that poorer outcomes are associated not only with increasing age, gender, ethnicity, but definitely within certain occupational groups, and there tend to be those lower paid occupational groups where exposure to the virus is greater, particularly occupational groups such as taxi drivers, bus drivers, social care workers, and of course increasing deprivation. And the reasons that increasing deprivation has led to that kind of unequal picture is because of those underlying health conditions and the preponderance of those high underlying health conditions in some of our neighbourhoods, and the longer term exposure to adverse factors, those inequalities in working conditions, and very often poorer housing conditions where there's very little access to open green space, and where families might be living in large groups together. In terms of the impact on the NHS, this slide is busy. I apologise for it, but these two, where I'm pointing to, these two graphs here, are probably the most important. They show the initial peak, the first peak of the pandemic in April and May, and you can see the impact on the NHS in terms of the number of beds taken up by COVID-19 patients. And then it shows you again in November the number of beds in the second wave that we've had. And you can see that that wave is slightly ahead, or slightly behind, I should say, of the infection rate. And that's what we would expect to see. We expect to see a high infection rate. People get the disease, and then it takes a little bit of time for that to have an impact on the NHS. But again, the trend is pleasing, because the pressure on beds and the pressure on high dependency unit and ITU beds is coming down in Northumbria Trust, and it's a similar picture in Newcastle upon Tyne NHS Foundation Trust as well. So things going in the right direction, but of course the NHS, its busiest month of the year tends to be January. I mean, in the midst of a pandemic, the NHS are particularly worried about the impact that they're going to be facing in January, particularly as we have an easing of restrictions between the 23rd and the 27th, which will encourage greater household mixing. And we know that household mixing is the principal route for transmission. So the total deaths from COVID-19 across North Tyneside, we've had 229 deaths cumulatively since the beginning of the pandemic. 74 of those have been in our care homes and 139 deaths in hospital. You can see from the chart that the red area is where COVID-19 is mentioned on the death certificate. The short lines that move across the graph show the 5-year weekly average death rate across North Tyneside that we would expect. And you can see that in the first wave, the mortality was well above the average expected mortality. And again, we've just risen above the average mortality for the last 5 years in the recent wave 2. In terms of current outbreaks, we've still got a number of current outbreaks across the borough. We've got 47 in total. And that map just shows the spread of those outbreaks across the borough. They're not really, there's no pattern to them. They're spread widely across North Tyneside. The biggest impact is in our schools, workplaces and care homes. That's where we've seen the most outbreaks, both cumulatively, and that's where the majority of them are to date. And they're across a range of workplaces. In terms of the new national tier system of restrictions, I get asked a lot of questions about the R rate. The R rate's not a helpful measure at a local level. It tends to be used nationally and regionally. It's a modelled estimate. It's not a direct measure, so there's often lots of variation in terms of the estimate of the rate, and we don't use it at local level, largely because we've got access to a range of directly measured data that give us a feel for what's happening at local level in a much better way than an R rate ever can be. There are currently 5 measures that are considered by the government to determine the level of restrictions needed for each local authority area. The first one is the rate of infection across the whole population, all ages. The second is the rate for over 60s. The third is the trend, in which direction and how quickly the case rates are falling. The fourth is the percentage of tests that return a positive result. And the fifth is the pressure on the NHS So those measures are combined, and a picture is presented to the Secretary of State for Health by the Chief Medical Officer, and a decision is made as to which level of tier each local authority goes into. And of course, there's going to be a review of those tiers on the 16th of December. In terms of the work around preventing and containing the spread of the virus, the impact and the work that we're doing is largely around infection prevention control, promoting COVID secure settings, and particularly thinking about high risk settings. So we've done a lot of work with the business sector, particularly in the higher risk businesses such as food processing plants, areas where there is food preparation, big companies where there are lots of people on site and where the tendency for transmission to occur is greater. We've been making sure that there's plenty of access to testing, that we're tracing the contacts of people, supporting the vulnerable to isolate, using our data, engaging with communities and encouraging compliance, and only using enforcement where necessary. We haven't used a great deal of enforcement powers in North Tyneside. We've tried very hard to engage with businesses and make sure that they're, encouraging them to do the right thing rather than using enforcement powers. They're a last resort. In terms of COVID secure workplaces, in all our business settings, these are critical in preventing transmission and outbreaks of COVID-19, keeping both staff and customers safe. And those measures include, making sure that a dynamic risk assessment is in place, making sure that there is collection of data for NHS test and trace, ensuring that employees who are symptomatic self-isolate and seek a test, and if they're positive, making sure that they self-isolate for 10 days, working out if any employees are close contacts of positive cases and ensuring that they self-isolate for 14 days, and then contacting specialist public health and getting support if an outbreak is indeed identified. So I just thought it would be useful just to go over when to isolate. I get a lot of questions about this. So if a person develops symptoms, immediately they should self-isolate with the whole family, book a test and wait the result. If the test's positive, the person needs to isolate for 10 days and the other household members need to isolate for 14 days. If a person is a close contact of a positive case outside of their household and has been asked to self-isolate for 14 days, the rest of the household does not need to isolate. That's because they haven't been exposed by the positive case and they're not at risk. In terms of repeat tests, we've had a number of issues with employers across the borough asking employees to show proof of a negative test after they've completed their 10-day isolation. This is not something that we should encourage. It's totally against national guidance. And the rationale for it is because the current tests detect residual virus in a person's body for a long time after you've had the COVID-19 infection. So people should only be retested within a 90-day period if they develop new symptoms. So the rule of thumb is once you've done your 10 days isolation and your symptoms have gone, you can return to your normal activity. Even if your cough and your loss or your taste of sense and smell isn't there, you can still return to work after the 10 days. The only reason that you wouldn't be able to return to work is if you've had a high fever. In terms of isolation payments, these are really important for businesses. So if someone's been told to self-isolate now, they are legally obliged to do so. As of the 28th of September, they could be eligible for the £500 test and trace support payment. To apply, they either have to be a confirmed positive case and have received an 8-digit number from NHS test and trace, or they have to be an identified close contact and also have received an NHS test and trace ID number. Now, there is help for employees to provide NHS test and trace with a list of your employees who have been identified as a close contact, because often close contacts are not necessarily identified through test and trace. So providing that you as an employer know the NHS test and trace ID of the positive person, you can ring the helpline and you can pass on the details of the close contacts, and they will then get an NHS test and trace ID, and they'll be able to apply for the payment, and they'll get it if they're eligible. And that payment can be applied for via the council website. So just some new developments. This is the things that are coming on board now. So there's a new communications campaign being launched this week, thanking the people of the North East and North Tyneside for everything that they've done so far to get us to where we are. We've also got the implementation of rapid testing. This has been introduced in care homes to enable safe visiting, but every local authority, Tier 3 authority, is also being offered the opportunity to develop community rapid testing. We're looking at that in North Tyneside, in the Riverside and Churton area, and we're looking to work with a high school, and we're also potentially looking to work with a couple of businesses to pilot an approach to community rapid testing, where we can offer over a 6-week period regular testing for employees. Obviously, you'll have all heard about the vaccination. It's great news. It's been approved. It's met the strict standards, and vaccination has actually commenced this week, being offered to NHS care workers, people aged over 80 in care homes. That's great news. But my last slide is really my parting message to you all is it's great news about the vaccine, but we need to continue to protect each other until there is widespread rollout. And my 6 key messages remain critically important. Hands, face, space, limit your social contacts. The fewer contacts that you have, the less chance there is of you getting COVID-19, and self-isolate with the household if you have symptoms, or if you've been in close contact, self-isolate for 14 days. Thank you very much. That's the end of my presentation.
Great, thanks, Wendy. Okay, I'll look at taking some questions now. Again, now you have the chance to finish Wendy's presentation there. If you're able to have any questions for Wendy, put them in the live chat, and she'll come back to you after I've covered the main business questions, which are on there. We've got a few from Adam at the start there about 1 grant application per company. Yeah, we have a look at that on an individual basis, so we will get back to you on that one, Adam. As a kind of, I'll try to give you a general response now with regards to if, say, your retail business, which had a property in North Shields and a shop in North Shields and a shop in Wheatley Bay, then yes, we'd support both properties. It depends on there are some grey areas within that. We look at each one on an individual basis, so I would depend on it. So if you had a business which just happened to have 2 industrial units which we use for storage for the business, then we'd probably look at that as one business, but we'd have to have a look at it individually. And I say we'll promise we'll come back to you on that one. Okay. Again, Jim, about acknowledging receipt of application, yes, we'll have a look at that and come back to you. We've had around 1,100, nearly 1,200 applications in so far, and out of those, we've paid out well over half of those, but there isn't a standard acknowledgement of application so far on that. So again, we'll have a look and see where you are. Local restrictions for barbers. Barbers will be eligible for the closed period with the national restrictions on there, but would not be eligible for the open scheme, as is defined by government, only hospitality, accommodation and leisure, and a barber wouldn't be classed under that. So a barber wouldn't be classed for open, but would be eligible for closed. Michelle, kind of similar to Adam's question earlier on with regards to per business operatable property. It kind of depends on the circumstances for that one. If it's 2 different business units, we'll pay it out per property. But again, if there's any issues, we can come back to you on a more personalised response. The additional restrictions grant, it isn't. Well, there is an additional restrictions grant at the moment. We're just using that fund to top up the local restrictions grant pot. But with regards to working from home, then no, at the moment there isn't a grant scheme for people working from home. It is only those with commercial premises. Again, this is following the guidelines from government that we have. I'll probably go into a bit more detail with regards to the funding that we have available. The additional restrictions grant funding, we've got around £4 million in North Tyneside for that, which is the amount allocated for the size of our authority. It sounds like a lot of money, but when you've got 10,000 self-employed people and 5,000 businesses in North Tyneside, it's not a lot at all. If I can just put it into relevance, that over the summer, we had the grants available in the summer, and we issued £34 million worth of grants to 3,000 businesses, and we didn't get anywhere near covering all of the people. There's a huge amount of people who weren't able to access a grant through that period. This time we have £4 million to cover a period of 15 months. So there is not going to be an open grant scheme for home-based businesses or anybody else, but there may be the ability for us to support a targeted group. So it may be that we're able in future to put out a grant scheme that's able to target people like home-based businesses who haven't been able to access the furlough schemes or didn't get another grant previously. It's what we're looking at now with the other authorities in the region, and we hope to it's probably going to be near the end of the year really by the time we're in a position to do anything about that. The additional restrictions grant money that we have spent is based on topping up the additional local restriction support grant, of which we don't know how much and how long that's going on for yet. So we can't commit to the scheme until we've got a better idea on those issues. Wet-led pubs. I agree, the amounts are really small. Unfortunately, that's what's coming from government. The general amounts for a pub will be quite small for the closed period, but also the £1,000 wet-led pub, I'm not sure what that's going to do, to be honest. It's quite a small amount of money. So again, there's nothing much we can do with that. It's national government who decide on these amounts. Tier 2. My understanding is the plan going forward is if Tier 2, if we go to Tier 2, but wet-led pubs are still not allowed to open, then you should be eligible for the closed grant going forward. So the local restriction support grant should still be eligible going forward. So we anticipate that would still be the case for pubs. That's as much as we know at the moment until it's confirmed by government, but that's my understanding that there would be a grant available, but it's at those amounts per month, which again are not huge amounts. Again, the additional restriction support grant, it's not a grant as itself, but we're using it to top up the local restriction support grant, and we would look at the events sector within that local restriction support grant. I can't promise we'll support every one of them, but we are looking at applications in that sector. And Karen, yes, the current schemes are around. You do need commercial premises, but we would potentially look at supporting others outside of this scheme, but it's not available at the moment. Again, Karen, asking about uptime home-based, not hospitality limited companies, etc. Yeah, I think I've covered that one already. Indication yet that we'll drop to Tier 2 on the 16th. I'll maybe let Wendy answer that one. Can I have some clarity on some application for the grants each month? Right, yeah, that's a good question. With regards to from Mike there about an application every month, just something we're trying to clarify ourselves at the moment as well. Our preference is that we don't have another application from businesses, and we've got a commitment to that from North Tyneside. So unless we're told by government that we have to have another application process. So the hope is that the people who are applying for a grant now for the period after the 2nd of December will 99% of them will have applied for a grant before that, so we'll have all your details already. So our intention is not to ask you to apply again for the standard grant scheme. Government has said the wet-led grant scheme you need to have a separate application form, but the general scheme we anticipate there being no application. We may need to clarify that you're still trading, so it may be a one-off kind of ticky box or a quick declaration that you're still trading, but there won't be an application to go through. We'll make that as simple as we can, and we'll come on that one. The tier grants, when can we get them? I mentioned earlier on, so that's the grant from 2nd of December onwards. Government issued the criteria to guidance to local authorities last night, so we're still working through that. At a rough guess, by the end of next week, the application will be open, but that's a guess from me at the moment, and I'm not too sure. Nearly got premises on the rate system. Office had to shut. Sorry, I missed that one. If your office had to close, it depends on the government guidance, Neil. So if you were a business which was kind of forced to close by government, then you would qualify for the grant scheme. If it's closed because your building's shut or other means, then unfortunately it's not part of the scheme which government have asked us to deliver. So that's the situation, I'm afraid. Move It Studios. Grants and see what was also future grants. Yeah, I totally take on board with regards to the length of time grants are taking to come through. It is a while, but what normally happens with these schemes is the government will give a declaration and an announcement about the grant scheme. Then about a week or a fortnight later, they will give the local authorities the guidance on how we deliver those. Then a week after that, give us further frequently asked questions and guidance, and then give us the money after that. So it tends to be a period of time before we can start issuing the grants to people as well. So this scheme, the Local Restriction Support Scheme, opened on the 19th of November. By the end of this week, we'll probably issue near £2 million on the scheme, and well over half, probably about 2/3 of the people who would have applied will have been paid by the end of this week as well. So we're trying our best, but when you get 11, 12 applications in one go, there's a process, the time it takes to get through those. So we are working on those. Daniel, with regards to remaining closed, so yes, you should apply for another scheme if you close as a leisure business. Our intention is not to need anything else. We just need a bit of clarification whether we need a declaration from you to say you're still closed to cover that period, 2nd of December to whether it's either a 2-week or a 4-week period that we're in, depending on what happens next week with the changes of tiers, or whether we're staying in tier 3. Monty, we look at events businesses now because it's the Local Restriction Support Grant. So, however, if that's based on the Local Restriction Support Grant are based on properties though. So if you're in a home-based business, then no, you won't apply for that. Yeah, I can't give you that an exact date on whether that will be available. We'd need to know what budget's left, and we've got to work through the current schemes first of all before we do that. And this is a decision we're looking to make as a 7 local authorities across the region, rather than just in North Tyneside. It's unlikely to be this year. It's unlikely to be in December. It's likely to be more January where we're able to come back anything firm on that. And Mike, I know that wet-led grants, no timescales yet, as I say on that one. Again, the government guidance came out last night, so we're still looking to process that. We'd hope to have something available at the end of next week. That's a hope from us. And Karen, yes, fully agree. Yes, with regards to the ARG grant, then yes, ideally that would enable us to support a lot more businesses and the home-based businesses and people who have not been able to access support so far. But 4 million isn't anywhere near enough. It sounds like a lot of money, but it's not. As I say, with £34 million we give out when we couldn't support home businesses then either, giving us 4 million now to support loads of other things as well as them, it's just not enough. So yes, I agree. That's the end of those ones. I think there was one main one, Wendy, earlier on about the time scale. If I can pass over that one for you to that one.
I haven't got access to any of the questions, Sean.
Right, yeah, I think there's only one main health question that came up there, which were 3 are going out to tier 2.
I think it's really difficult to say, to be honest. I think it's a difficult one to call. We have heard from government that, and some of the advisors, that they're not going to move anybody from a tier 3 local authority into a tier 2. So I'm afraid we just have to wait and see. I've got no idea. I have no feel for whether or not we're likely to move or not, I'm afraid.
Yeah, okay, thank you. And the final one there from Mark with regards to pubs, then yes, really a pub could access an open grant, the closed grant, and then the £1,000 would be on top of that as well. plus any ongoing grant from the 2nd of December onwards. So yes, that is the case. Adam, no, there's no application process. Every authority is doing the same thing, so we are feeding this back to government. There's a return on a weekly basis that we feed back, and this is something we cover on that regularly. We have asked through that process, but there's not actually a fund we can tap into to do that. And Jill, yes, that's correct. There's no application available at the moment. Again, the guidance was out yesterday, so the anticipation is hopefully we won't need an application for that. So most businesses will have applied for the open and close grants previously, so we hope to give an automatic payment with perhaps just a declaration. But if you haven't applied for an open and close previously and are only, for whatever reason, are only eligible for a grant 2nd December onwards, we will have the same application processes available now. But yeah, that's correct. There's nothing available at the moment. Okay, I think that's the end of the questions there. Just kind of touching on Wendy, is there any kind of frequently asked questions that you get generally in this situation that you want to comment on, or have we covered most things in your presentation?
I think I've covered most of them, Sean. I've tried to pick up most of the questions that have come in through enquiries and other questions that I've had throughout. So I think I've covered them all. Yeah,
great. Okay. Thanks very much, everybody, for getting involved. Really appreciate your questions and your commitments and listen to us today. So the plan is we'll have this available on the website for people to look at over the next week or so before the advice gets out of date. And we'll try and put some frequently asked questions together so that people can get that access, and everything else is available on the website. So thank you very much, and let you go and get your dinner now.
Thank you now. Thanks, Sean.